This is pretty cool. And the
Yeah, I
public
like
likes
it.
this.
Yeah. Yeah, you gotta give them Okay, so we're live streaming now. Welcome everyone to our in-person meeting. Today, we're going to be getting Narcan training from our Maimonides healthcare worker. And without further ado, I'm going to give you the physical stage today.
Oh, great. Thank you so much. Thank you for having me. My name is Michael Dixon. I'm one of the paramedics at Maimonides Medical Center. And I want to thank you for having me here to do this very important training. So just to give you a little bit of background, how do we end up in this opioid crisis that we're currently in? It actually started over 2 decades ago. So back in right around 1999, we saw a big wave of a lot of people overdosing on prescription opioids at that time. And then we had a big resurgence in 2010. And then the second wave was mostly from heroin use. And the big problem that we're seeing today is fentanyl. And fentanyl is being put in heroin, it's being put in cocaine, it's being put in a lot of drugs that drug users are using. And a lot of times they don't even realize that the fentanyl is in what they're using. So the fentanyl is about 50 to 100 times more potent than morphine is. And that's what's leading to a lot of these accidental overdoses. Here in New York City, the problem is just getting worse and worse and worse. So since 2021, we've had about 2,668 deaths, and that was up 78% from the year before. So it's just getting worse and worse every year upon the year. Fentanyl, when they test a lot of the deaths from drug overdoses, for the last 5 years, about 81% of drug-related overdose deaths were involved with fentanyl. So that's why it's such a big problem. And what the city has done, and what a lot of the medical institutions have done, is try to get naloxone and Narcan out in the hands of everybody possible to have the greatest availability, because it can save somebody's life. It's one of these reversal agents that only works on the opioids, but it could save their life if they are barely breathing or stop breathing. So how do we recognize whether somebody is overdosed on opioids? The telltale signs is a lot of times they're going to be unresponsive. So we can check for responsiveness. We could gently rub on their chest and see if we could elicit a response. And there may be barely any response from them at all. The other thing that we would see is they would either be barely breathing or very shallow breathing. So they will be breathing maybe 4, 5, 6 times a minute. And that would be usually from the opioid overdose itself. Other things we could see, sometimes their lips will be blue, their nail beds will be blue or pale from that as well. And sometimes when they do breathe, they'll get these snoring respirations about them. So if you do see that, and there are no response, the first thing you want to do is call 911. So get an ambulance coming to you. At least help will be on their way for you. And if you do have one of these naloxone kits or Narcan, this is the formulation that is being distributed. New York City is giving away a lot of the Narcan kits. They're also stocking Narcan in a lot of the venues. So we see them at sporting events and sporting arenas. They're putting Narcan with the public access defibrillators. So the same place that the defibrillator is has Narcan kits available as well. And a lot of the concert venues are having these vending machine type of distribution points for Narcan. So
What's the difference between Narcan and Nexalon?
it's the same thing, just a different name for the same medication. Yeah, the actual name of the medicine is naloxone. The brand name is called Narcan. So it's the same medication. And this is actually a 4 milligram dose, and it's meant to be put into somebody's nostril. Oh, sure. Yeah, no
Slow down
worries.
for 1 second.
Yeah, absolutely. Good evening. Welcome, welcome. How are you?
Great, thank you very much.
Absolutely. What you have here is the information sheet on what to look for as far as signs that somebody may be overdosed on opioids. It tells you to call 911 and then directs you on how to actually administer the naloxone. And it's very simple, minimally invasive. It's meant to go into somebody's nostril. So they call it the 3 Ps. It's peel, place, and press. So when we open up these Narcan kits, we're going to just peel back the foil. And then it's meant to just be taken out, placed into somebody's nostril. It doesn't matter which one it goes in. We usually go for the bigger one, which is usually the right side, anywhere that it gets in. And then what you want to do is you want to use your index finger and your middle finger to place on the top of the device. And then your thumb is going to be on this red plunger. You never want to test it Because once you push it, it activates it and then it's gone. Yeah, so it's not meant to be a multiple dose situation. It's meant to be one and done. So we place it in the nostril and then we just press on that plunger and then we remove it. How long? Oh, I'll show you in the air. Once you press it, it squirts and done. And then you could remove it. So not even a second, as soon as you press it and the medicine goes up there, you can take it out of the nostril. And then it should start to work in 2 minutes. 2 to 3 minutes, you should see some response from that medication, from the naloxone. If you don't, and you have a second dose available, you could always give a second dose for that patient as well. Important things to remember, try to stay with the patient if you can. Sometimes these patients, when they do wake up from the Narcan, they're going to want to leave right away. They're probably not going to want to go to the hospital. They may not want to do nothing with you, or they may want nothing to do with EMS that shows up on scene. But we always encourage them to go to the hospital because the naloxone only works for about 20 or 30 minutes before it starts to wear off. And if they've taken a lot of opioids or if they had a lot of fentanyl, they're going to walk a couple blocks away and they're going to be passed out shortly after that. So we try to get them to the hospital, try to get them monitored if we can. Just be safe. You don't want to get yourself in an aggression situation with anybody.
So like, does the person have to be sitting upright? I mean, does it make a difference?
It doesn't make a difference in what position they're in when you administer the medicine. We always encourage, though, if they are unresponsive, try to get them onto their side so that if you give the Narcan and they go into withdrawals, which they could if they're a long time addicted to opioids, a very common reaction for them is to vomit. So if they're on their side and they vomit, it's less of a chance of them swallowing it and ending up in the lungs, where it's problematic. If you have a kit available that has a barrier and you want to give mouth-to-mouth ventilations, I know a lot of people are a little hesitant to do something like that, but there are some barrier devices that come with the Narcan kit to give some ventilations until.
We did, let's take a look at them and maybe explain to us.
Yeah,
Department
absolutely.
of Health.
Yeah, these
provided-
come from the New York City Department of Health. They come from the New York City Well program. And in here, there's a certificate of completion, and then you get gloves. And then this comes packed with 2 doses of Narcan. So it allows you that initial dose for the naloxone. And then if in 2 to 3 minutes you don't see a response, like the breathing is gonna start to get quicker or they're gonna start to wake up, then we could give a second dose 2 to 3 minutes after the first dose. And they don't have barrier devices in here. Oh yeah, they do actually. So they do have the safety shield. So what this is just a piece of film that you would place over somebody's face, and then you can give them mouth to mouth without actually having to touch their skin. You know, some people are a little hesitant to do that. Yeah. Especially for things. This is what we used to do when we used to do CPR training. And you take that face shield, place it over somebody's mouth, and then you could just pinch their nose, tilt their head back and do ventilations that way. If you're feeling so inclined. After you administer the naloxone, it's always recommended that you call the 888 New York City well number to report the usage. New York City tries to keep track of all of the naloxone administrations.
I have one question. Is there any age range,
Mhm.
like too young or too old?
No.
You could be old and still get.
Yeah, absolutely.
Chance for us.
Yeah. We see that a lot of times with the prescription medication.
I know,
A lot
that's
of
what it
the,
is.
a lot of times people are forgetful and they accidentally overdose
Right.
themselves on Percocet,
Whatever.
Vicodin, Dilaudid, whatever they have at home. Thinking that they forgot to take their dose in the morning and they end up doubling up on their dose. So it is possible that it doesn't always have to be illicit drug use that we see
Right.
overdoses from. We can see. it
What
with
about
prescription painkillers.
diabetic, someone in diabetic shock?
Mhm.
Was this appropriate?
So it's not going to be harmful, but it's not going to do anything
Okay.
to help them. Yeah. Problem with them is they need sugar,
Sugar.
so they need to have a different situation.
Right.
Good thing about naloxone is that it's a relatively safe medication. So it only works on opioids, but even if you thought they were on opioids and they turn out not to have taken opioids, it won't be particularly harmful for them. So that's the good thing about it. That's
Does it matter at what point you give it? I mean, you know, you have some people that look like they're nodding out, and you can tell, and then there's some people who are out cold or foaming them out.
Yeah.
Does it matter?
No.
So at
Not at
any
all.
point during an apparent overdose,
Mhm.
just go for it.
Yeah, the telltale sign there is that they're either gonna be minimally responsive or.
Yeah,
overly
sure.
responsive. Yeah, if they're responsive enough, they're probably not gonna let you squirt anything in their nose. But if they have such a decreased level of consciousness that they're barely responding to you when you're trying to elicit a response, would be appropriate to administer the medication. And you're right, it doesn't matter when you give it or when to wait to give it. The whole point is that it's gonna kind of reverse that respiratory depression that they get from the opioids. And the sooner you get it in, the better off they're gonna be. But you do bring up a good point, is that it is a 4 mg dose, which is a relatively large dose. So a lot of the, especially the long-term opioid addicted people are going to have a possibility of going into withdrawal after the administration.
Wow.
A lot of times they'll shake, they'll shiver, they'll get the chills. And the big problem is that they end up vomiting a lot of the times from that withdrawal. So that could be problematic. Just be aware of that. Watch out for that vomiting.
How many people so far have actually used it? Do you know?
Use which,
Narcan? Do you know?
do we have those
It's
numbers?
successful so far?
It has been, they've distributed over 32,000 fentanyl test strips. So they were giving out test strips to test the drugs to see if it has fentanyl in it.
Okay.
And as far as distribution of the naloxone kits, just under 160,000 kits citywide have been distributed to date. Let's see, does it say how many people it was used on?
I'm curious because I think that a lot of people probably feel intimidated to approach someone.
We don't hear you.
Yeah.
I was saying that maybe people are intimidated to actually use it on somebody who's doing an overdose. So I'm curious, yeah.
Yeah, that's true. I don't know how many lay people have administered it publicly,
Thank you.
but I know they're trying to put it out everywhere that they could possibly put it and get it into the hands of as many people
Yeah.
that they can.
Yeah.
So not only do you get free kits from the New York City Mental Health and Hygiene, it's also available over the counter from any pharmacy without a prescription, so you can purchase it at CBS.
How long does the kit last?
Usually the expiration dates are good for generally about 2 years. Yeah, once the expiration, so this one is good until March of 2025. So most of them, when they are out of the manufacturer, they get about a 2-year expiration date on them. And then once the kit's expired, if you do call that New York City loan number, they could replace those kits for you.
So a hypothetical, let's just say it's expired.
I don't hear
You
you.
know, a hypothetical question, let's just say it's expired and you know, someone has OD'd and do we still use it?
That's a good question.
Something is better than nothing,
That
right?
is true, yeah. In medicine, generally, we're told don't use expired medications, and not because it's particularly bad, but all the times they can't account for the potency of the medicine after its expiration
Right.
date. So I don't think it's going to be particularly harmful.
Mhm.
I don't know what the official medical advice they could tell
Right.
you about giving expired medications, but it probably would still work past its expiration
Mhm.
date. You know, if that's helpful for you.
No, I'm just curious. I mean, something to me is better than nothing.
Yes.
If you're already down, you're down.
Yeah.
You know,
No, that is a good point.
How much is it in the pharmacy?
Oh, I don't know. That's a good question.
I've
Yeah.
actually searched up on the way at Walgreens, it's about $45.
For dose?
Yeah, I don't know if
Really?
it's one or a few.
Or if it's two.
Yeah,
Oh, that's
I'll
interesting.
check as.
Wow.
Training, though, like, once you've like done this,
Mhm.
you can get it for free at a lot of pharmacies, even in the area, because I was looking them all up when we were trying to get kits for this,
That's
that
great.
that we get from the city. But we were trying to figure out how to procure them, and there is quite a few, like the smaller, like local pharmacies have them. And if you say you were trained, they'll come to you. I could just email Josephine a list afterwards from the city site.
I know a few months ago I had looked on like Amazon and it's like, it was like $100, $125, $200.
Yeah.
Yeah, the city of New York, and I think partially the state, but mainly the city has kind of paid for a good chunk of them to be there to actually get them into people's hands to use them. Yeah.
I know the State Department of Health had a big push and was supplying a lot of the Narcan kits, but I think that has ended.
Yeah.
So
It's
the
a-
city has also now are distributing the kits, so they're still available for free from New York City.
Yes, the New York State Department of Health does offer trainings. Currently now they're doing them virtually, but we wanted to have an in-person training, so we're very grateful to Maimonides. But there are CBOs and Oasis managers. So we obtain these kits from an Oasis manager at Healthcare Choices in Borough Park. And we reached out to a number of Department of Health had a list, so we called them all in. They were generous enough to donate kits for tonight. But I didn't realize that, Kate, about if you're trained by the Department of Health.
Yeah, I want to say, I know there's a bunch of local pharmacies, and I think CVS maybe has a partnership with the city. I don't think there's a CVS right around here, but I think they in general have a partnership with the city too, so you can kind of go in and they'll basically just give them to you. I don't think in bulk, but like you're entitled to like a kit.
That's fantastic. Yeah.
And they distribute it, do you know where? Like, do they distribute it to schools?
I don't know if they're in schools.
Organization?
Yeah, I would think so. I would hope that they would.
Probably be a good addition.
Yeah.
This just seems so wonderful. I can't believe that you're not getting more publicity. I belong to a lot of different organizations, and this is the only group that has anything. And now here, this is life-saving, you know, plink, and you revive. It's just so simple. And I'm just surprised that
Not more.
our other organizations in the neighborhood aren't picking up and bringing it to their groups.
A number of years ago, we had a training at the height of the opioid crisis. And I think, hearing more overdoses recently, and Barbara brought it up before the summer break, and then the horrific tragedy at the daycare center with the vets. I think all of us, Barbara really verbalized it at the last board meeting, but certainly it seems that if we, have the training and availability of the kits, we could save the life. I think for me, the biggest apprehension is how do you know, if a person is unresponsive, knowing whether or not, what it could be. Could it be an overdose? Could it be diabetic? Could it be something?
They have choked on a grape.
Yeah,
Yeah,
Yeah.
it's,
but I guess the good part about this is that it's such a safe medication that it doesn't really matter. If it is a diabetic emergency and it's a sugar issue and you give this, it's not gonna harm them.
Yeah.
So it's better to err on the side of caution and say, if it is an opioid overdose, just go ahead and give Narcan.
So if I
It
go
doesn't work, it
into
doesn't work.
CVS and I say I was trained, and they're gonna say, prove it to me. Do we get it?
You can look on the city site and see exactly what they say. I think
Yeah.
in your
They
kit,
had
there's
a-
actually,
yeah.
I think a little.
Yeah,
Yep,
there's
the certificate of completion.
Yeah.
I don't think you
Make sure you
would have
take
gotten those particular kits without having been
Mhm.
trained, I assume. When you
yeah,
picked them up,
so
that was
when I
part of it.
picked them up, the reason why they were given is that we had to provide Maimonides information about the training, and that they provided to us, because of the training. That's the only reason why we received it today.
It's right, yeah, it's got a little card that you put your name and
Yeah.
today's date on.
Okay.
And
But can you
then
go over that again? Is it just really just a simple
it is,
word?
yeah, it's just a peel, a place and just a press, yeah, it's that simple. Yeah,
Like an average nasal spray.
yeah, almost like if you were using it for allergies or something. It was just that, but once it's activated and spent, then it's spent, the medicine was no longer in there.
That's it.
But
So we
yeah,
should call 911, the very first thing.
absolutely, yeah, call 911 first, so that's why at least you get an ambulance coming to you. And then get the medication in, and it works very, very quickly. Usually in the first minute or two, you're gonna start to see that person become more responsive, wake up, you're gonna see their breathing improve. If you saw that their lips were blue, their color starts to improve relatively quickly. Unless they had a large dose of it, or they had a batch of heroin that had a particularly large amount of fentanyl in it, it's usually where it takes a second dose to reverse some of that.
I think in the pharmacy, they give it to you free, and the pharmacist is not supposed to call the police for you. I mean, you are free to go anytime to get it free from the pharmacy.
Also, if you're the person who you feel is overdosing.
No, not that.
Oh, no, it's, okay.
I mean, one of his family.
My family members.
We have been trained in the Islamic Society. They were giving for that.
So it's fantastic.
Yeah.
It's excellent. Yeah, they're trying to get it out there in as many hands as possible. So whether you're just walking down the street and you see somebody that may be unresponsive on the sidewalk, or you may be out at an event or a show or a concert or a sporting event. And then you may see somebody there that may be overdosed on opioids. So they're trying to increase the availability of it as much as they can to get it into as many hands as they can. Unfortunately, most people die of opioid overdoses because it wasn't recognized or there was a delay in getting their own box on. And the sad part is that once they stop breathing, kind of missed their opportunity to give this reversal medication. Because once they stop breathing, they very quickly go into cardiac arrest. It's a different
Well, I thought
situation.
it was wonderful that when those EMTs were called to that daycare,
Mhm.
they administered to these
Yeah.
children.
Yep. Yeah, if you
That
could
they
get
were
there in
able
time.
To recognize.
To
yeah,
recognize.
Absolutely, yeah. If you get there in time, that's why I think the 2 of the 3
Right.
babies survived, right? The one, unfortunately, it was too late, right? Yeah, so that,
And it's real powerful. You don't even have to ingest it.
yeah. Yeah, there's no needles involved, so it's safe. You don't have to worry about sticking yourself with the needle or sticking your needle into somebody else.
No, and then the fentanyl.
Oh, the
You
fentanyl,
don't
yeah.
even have to
Yeah,
ingest it.
yeah, it's so potent. You could just be exposed to it just from the environment that you're around. It's interestingly, a lot of the illicit heroin that's out there is getting fentanyl put into it to make it even more addictive for a lot of these drug addicts, unfortunately. And they don't even realize that it's in there. Or there may be a large dose of it in there and they're using the same amount that they normally would, but there's fentanyl in it and they don't realize it. And that's, like they end up in this situation that they stop breathing. Yeah. So either they're alone when they're doing it, right? And then there's nobody to recognize it. And then unfortunately, it's too late where they stop breathing. But if they're in a public space or arena and they accidentally overdose themselves, then this would be a great tool to have for them.
No, I just wanted to say, I was at a senior facility yesterday, the Bay Ridge Center. And they had a whole program yesterday about diabetes. And it was really fantastic. And one of the reasons why I went is because my granddaughter, Julia, is going to become a nurse. And so it was her class that was giving the program about the diabetes. And so they took questions from the audience, we were all seniors. And it was just amazing how many questions were asked of them. This would be like a gold mine. I'm going to bring it back to them.
Yeah, that's a very good
I mean, there's just so many seniors that go to that facility. And this is like just so wonderful. I mean, really, it's a miracle, really. It's so simple. I mean, they had to do so much, for the diabetes. If you went into, they were giving out.
Well, this is not
forms
for
and everything.
diabetes though.
No, but I'm just saying, I know it's not, but I'm just saying this would be like something wonderful to bring to that group because it's a very big group and they're opening up a new facility.
We're actually gonna be partnering.
November
with them.
1st.
Yes,
Okay,
so
so
the hospital's
That's great.
partnering and we're gonna be kind of running their wellness
It's
center.
gonna be
So,
fantastic.
That's fantastic.
So it's just,
The training.
Yeah,
Yeah.
absolutely.
It'd be great in the
Yeah.
high schools, like a.
Right.
Absolutely, yeah.
That's what I was saying.
They should be in all restaurants and bars.
Everywhere, yeah, everywhere that we could possibly put it, yeah, with every first aid
So
kit, with every
simple.
defibrillator. Anywhere that's a public space, I would say that it would be a great idea to have this available. Yeah, years ago, we did Stop the Bleed campaign with the public schools. So we were in there teaching the teachers how to stop bleeding.
Right.
In this day and age where you're always worried about school shootings and active shooter drills. And so we went into the skills and we taught the teachers how to stop
Right.
bleed if they needed to. So why not? Yeah, you're right. Go into the schools and not only the nurses, but show the teachers how to use these devices. If they need them.
Yeah, 'cause when I came tonight, one of the things I told Josephine, I said, I have a blood clot in my carotid artery, so I've been having to inject myself twice a day for the last 6 years. And I said, I'm not afraid to inject anybody, but this is like
Yeah.
a total reversal. But the one thing in reading this,
Mhm.
people have ideas like, oh, could I go up to somebody who is a drug addict and this and that? But it's not only drug, it can happen to people with their kids or an older adult taking the wrong medication.
Yep.
And because the
Absolutely.
first thing I'm gonna do is I'm gonna go home, send this to like everybody I know. And if they work at a facility where they have a nurse or somebody who's like in charge of like health or anything, see if they can get somebody in. And at the same time, let them know it's a lot easier than you think, you know, and even though like somebody could take something because maybe they can't afford to buy their medicine. Like I'm lucky, I have great health insurance, but I'm on a lot of medication. If I had to pay for it, I would be broke. But like people will sometimes do something out of desperation, doesn't make them a drug addict, just makes them somebody who needs to be medicated. So this just really dispenses so many things. I'm reading it, and there's a level of compassion here that's like really makes me feel like, okay, I'm gonna take a kid, my church is right next to a park where there's a lot of things happening. My pastor couldn't come, I'm gonna give it to him. But this is the kind of thing where he would be the type of person that would say, let me go see what I can do. And you know, take this in this
That's
pocket.
fantastic.
So,
That's great. And that's a great
Yeah.
point too. You don't always assume that it has to be a drug addicted individual that's overdosing on opioids.
Yeah.
We see a lot of it on prescription medications. So whether they're on morphine or dilaudid, which is like more potent form of morphine, it's like 10 times more potent. So you see that with a lot of patients that have cancer, end stage cancers, chronic pain. It's prescribed, and you're right, maybe there's sharing of prescriptions because they don't have access, or they can't afford it. And then there may be some forgetfulness surrounding their dosing, and they accidentally overdose
yeah, like
themselves.
my mom has Alzheimer's and she's on 5 different medications that I feel bad for my stepfather who's really got to monitor it, because I can call and say, Mom, you took your meds? No. And then she really just doesn't remember. And she can go and do it again and again 3 or 4 times if nobody stops her. Like,
Yeah, because you forgot you took it, you want to take another dose of it.
Yeah.
Everything from, we see that with a lot of teenagers and young teenagers too. We see that a lot in Long Island and Staten Island, not so much in Brooklyn. But they're going into their grandparents' medication cabinets and they're looking for the Vicodin and they're looking for the Percocet and they're crushing it up and snorting it, and they end up overdosing from that. Yeah, so it doesn't always have to be heroin from the street that they're getting access to. Absolutely right.
And this would work on it.
Yeah, absolutely. Yep. Any opioid medicine or illicit drug or otherwise. Yeah.
So Mike, it's okay then, so you should, if the first dose doesn't work, I just want to be careful.
For 3 minutes, you could give the second dose.
You give the second dose. If that doesn't work,
Well, then you're out of it. Because then you only have 2 per kid. Yeah.
you try to get rescue breaths with CPR.
Yeah.
I'm not CPR, I haven't done CPR in a long time. but-
Yeah, that's why they give you that barrier device in that side of that kit, which is, I know a lot of people are a little hesitant to get their face that close to a stranger's face.
I've heard
So
that.
at your discretion.
Yeah. I've heard it's not as useful to use this, but like the compressions are really, really important. Like,
Yeah.
even if you decide to do that instead of breathing.
Yeah, American Heart Association has moved towards layperson compressions only, just for that very reason, because they found that a lot of people were hesitant to get their face and their mouth that close to a stranger's face and mouth, because they're worried about disease transmission and hygiene and other things like that. So they found that, well, providing compressions is better than nothing, and it's actually is pretty effective because you still have some oxygen in your blood for a period of time, so you don't have to focus on giving those rescue breaths. If you want to, then sure, that would help. But when you get pre-arrival instructions, if somebody calls 911 and looks like somebody is in cardiac arrest, they'll say, just put your hands in the center of the chest and just compress until help arrives for you.
And that's a great point. So even like you said, the first step is to call 911. So they would be instructing you also in case you forget
Absolutely.
how to use the spray,
So-
how to go through it.
I'm even.
They see you're a little nervous.
That's right. Corey seems to know.
That's grind your knuckles into the breastbone, sternal rub.
Yeah.
So you don't have to memorize
And
everything.
of course, where was that exactly? Exactly.
Yeah.
Yeah, so they look at them.
Yeah, that's usually a very sensitive area, and as you're doing that should elicit some response from that person, and if it doesn't, then they are severely depressed.
And you said to wait 2 minutes. after.
2 to 3 minutes, yeah, that's what you're gonna wait before you give that second dose. It takes about a minute or 2 for the medication to circulate and for that reversal to start to happen. It's pretty quick, like I said, a minute or 2, and you're only gonna reach for that second dose, and they have a lot of opioids, are very powerful opioids like fentanyl on board, and may take a lot of reverse. So, but usually the first dose, most of the time, is gonna work for you. Like I said, just be aware, just in case they wake up and vomit at you.
Yeah. So
We'll look for that.
it's on the
That
side,
retching is
it'll
gonna
be-
start to happen, and that's why we try to get them on their left side, so that if they vomit, it drains from their mouth and they have a less chance of ended up swallowing into their lungs particularly, yeah.
that the person, doesn't wake up, you know, immediately, do the second dose, then do the chest. Okay, I'm just trying to get this straight,
The order,
you
yeah.
know.
The first thing you do is that external rub to try to see if they're responding
That's
or
it.
not. And if they're unresponsive, then that's a true emergent situation there. And if it's from opioids, they're probably also gonna be barely breathing at that point in time. So you may see these like intermittent gasping, snoring respirations are usually the telltale signs. And if you wanted to open up their eyes and look at their pupils, sometimes their pupils are gonna be these tiny, tiny little pinpoint situations. And that more times than not is also a telltale sign that they overdose on opioids.
So they appear a lot smaller.
Very, very small. Yeah, very, very constricted and tiny, little pinpoint. And a lot of people take out the flashlight on their
No,
phone
yeah,
and look at it. But yeah, they're barely breathing, not very responsive. And you open their eyes and they got these pinpoint little dot pupils. That's telltale signs that it's probably an opioid that's causing that situation. Yeah.
Yeah, I think too, the biggest concern with fentanyl is should there be a fentanyl overdose and that it's so easy to transmit. I can understand that, you know, that apprehension for
Sure.
for people, but knowing that this can immediately save or revive a person.
Yeah, you just have to
Keep it on hand.
get them before they stop breathing. It's the whole trick of it, to get there in time. And if you want,
And I think we could, you know, this, since we're videoing this, we could certainly share this,
Yeah, everywhere.
and, you know, share it. Certainly everywhere, and that's June's point, is everyone's point in spreading the word that this is available and kids and training.
yeah, they
you know.
still funded, they still have the city about whatever getting the kids out. So.
And explaining what it is, even if people don't even realize,
So-
especially a prescription thing, I think people don't realize you can be taking normal medication from your doctor and go through something like this, so. It's good to have them covered.
Oh, yeah.
For me, my training is, I'm an Afghanistan war veteran, so we have our particular first aid when we do things. So since, when at the point maybe a person have a heart attack, you need atropine to get it started, or this particular one, so I'm not sure what's the difference that I can identify to administer the right medicines that, no, again, my battlefield training is different.
Sure, so the naloxone is safe in case you misidentify it and the person is unresponsive for some other medical reason. And somebody go ahead and gives this, it's not going to particularly be harmful for them. So it's always easy to err on the side of caution and give it if you see the signs. And the signs traditionally are if the patient's going to be unresponsive or barely responsive, very shallow, slow respirations. And a lot of times those respirations are snoring in nature. And sometimes you'll see that their lips and their nail beds, and if you pull down their eyes, the membranes of their eyes are going to be either pale or bluish in
Yeah, that's what
nature.
it starts at.
They'll have cyanosis and blue color to them. And then if you open up their eyes and you shine a light in them, they have those very, very constricted pinpoint pupils. And that's almost always the combination of signs you're going to see with an opioid overdose. If there's something else that's causing it, like a stroke or a heart attack, or we talk about a diabetic emergency with a sugar may be low and you don't recognize that. If you give this medication, it's just not going to work for them, but it's not going to hurt them.
You still have 911.
Yeah, and then
Well, that's what I'm saying,
Yeah.
call them, put them on
Immediately
speaker,
give them
Yeah.
a speaker.
and let them guide you through it, knowing that you have this training.
yeah, we always recommend call 911 first, because a lot of times once you get involved in interacting with that person,
Yeah.
then yeah, you kind of get busy, right? And 5 minutes go by, 10 minutes go by, and help's not on their way yet. Right? Somebody, a bystander, or then maybe you pick up the phone and then call 911. If you call 911 first, that ambulance is going to be sent to your location. So you got help coming to you. Hopefully pretty quickly. Hopefully we get there, in a couple of minutes.
Even if the patient wakes up with the naloxone, you should also take it. to the-
Yes, absolutely. Yeah, we always encourage them to go and get checked out. Only because, like I said, this medicine is gonna start to wear off within 20 or 30 minutes after you administer it. And if they've done a lot of drugs, a lot of heroin with fentanyl in it, the opioid effect is gonna come right back, and they're gonna end up right back in the situation that you found them in. So they'll end up unresponsive, barely breathing again. So they may have to have multiple doses, and they have to be monitored for some time. And if they were without oxygen for a period of time, it's always good to get evaluated by a doctor.
They should be followed up for the rehab centers and
Ideally, yeah,
they should go through the whole process.
yeah, we would hope, yeah, that we get them into some sort of rehabilitation and rehab and drug program and. And unfortunately, a lot of the times they're back in the same situation. Daily or weekly, but that's why I said if they wake up, they may or may not be cooperative with you. Even with us, when we show up and we wake them up with the naloxone, a lot of times they are refusing to go to the hospital. With us, with EMS, say, yeah, we want you to be safe. We don't want you to physically restrain anybody and say, wait for the ambulance. Right? Like a lot of times they might just wake up and walk away from it. But if we can encourage them to hang out until EMS gets there, then we'll try to convince them to go to the hospital, and sometimes we're unsuccessful as well.
I think with the training, also another question that comes up is why even bother? So what is the response to that?
Why bother what?
Why bother even using it? And sometimes maybe believing that person is better.
No, sometimes it can be that
I'd like to
person
have
that
that on
they-
the record that, yeah, it's not the best way, but
I know, yeah, that could literally mean the difference between life and death for that person, right? Like if they're there and snoring and barely breathing and you say, well, oh, well, somebody will call 911, it's 5 minutes, 10 minutes, 15 minutes it takes for the ambulance to get there. The person stops breathing and we show up with our Narcan and by the time we too late, right? So yeah, it could save a life. This is one of the things that can literally save a life
yeah.
in minutes, really, yeah.
I'm curious with the schools, are the superintendents approached in our schools or the principals and asked to have a program for their teachers to train them?
No.
Are you able to do that?
No, I'm not aware of that. I'm sure we could certainly do it. My wife teaches third grade in elementary school, and she hasn't mentioned any naloxone training that they've been doing. They have some of their staff CPR training.
Yeah, but if request now.
They do the active shooter drills now.
But
and
if
we do the
requested,
stop the
you guys
bleed.
would go.
Yeah, why not? Absolutely.
I think it's
Yeah.
more important to do with the kids, the teenagers, and because
Yeah,
that they know
Yeah.
how to respond if they're friends or if they're in an environment.
Yeah.
it's
Especially,
just like
yeah.
so simple. I mean,
Yeah.
Yes, sad as it is, you see that middle school into early high school, and like I said, a lot of the common
Trying
pathway
everything.
into opioid addiction becomes going into the parents or the grandparents' medicine cabinet. Taking those Vicodin Percocets, crushing them up and snorting them, and they quickly find out that they could get heroin much cheaper on the street. And then that starts the vicious cycle of opioid addiction for them, and they're relatively young, and we're seeing it at 14, 15,
The
16,
fact that they
17.
realize if they're doing this on their own and nobody's there to give this.
Yeah,
right.
that's
exactly.
what they got.
Yeah, or not recognized, or it's sad.
Before the pandemic, we had a vaping panel. And we learned so much from it, and we invited all the schools to come. I think that YouTube yielded hundreds and hundreds of views because the schools did take,
Still on, yeah.
it's still on, and it education and knowledge is power. Just really understanding and knowing from this, applying naloxone to, for the young people to understand, the potential of what could be in vaping or what could be in products out there that a friend of yours gives you something and something like this happens. I think that it's so important to talk about it, to be open and honest, and to understand that, simple things like this type of treatment can save lives.
Especially if you get into the hands of the family and the friends of the people that are using, right? And then it becomes readily available for them, and then they know what's recognized, and they have the reversal agent for it available to them. So do you want to see it one more time?
Yeah, why not?
When it comes back and we peel it, instead of squirting into the air, actually squirt it into the nostril. And so we just peel, take that out. And what we're gonna do is we're gonna put index finger, middle finger, and our thumb on the red tab, and then insert into the nostril, and in one quick move. And release. That's it.
It's like just.
Yeah.
And you saved his life.
And that could be a difference between life and death for somebody that is barely breathing. Yeah, and then within usually a minute or 2 minutes is when you're gonna start to see, it's almost an immediate effect. It's very, very short. Yeah, but they say if it doesn't work in that first 2 minutes, then you can think about picking up that second dose and doing that second dose.
Any other questions?
You
No.
can purchase this without prescription now, is
Mhm,
it?
yes, yeah, you could get them, that's what we were talking about earlier, and it sounds like if you had some training on it, some of the pharmacies will give it to you for free.
Yeah, the New York City website, I kind of like just dug around on it and it lists quite a few that like the city has partnerships and also just like local pharmacies that will give them for free if you have the training card.
Yep, and the New York City Well program as well. New York City Well will give out kits as well, there's some funding through the New York City Department of Health.
Well, I thank you so much for your time.
Thank you so much for having me, I
Thank
appreciate
you. And hopefully, now we're armed with this knowledge, but hopefully we never have to actually use it. As they say, when we get the PR certification, that's good.
It's one of those things that,
Yeah,
I hope
at
you
least
never
you
have to,
know
but
it.
yeah, but if
Yeah.
you need it, then.
That it doesn't like freak me out sometimes.
So you don't like roll over. Yeah.
Yeah, even approaching them, I think. The initial like.
It's very-
That's why I asked that question. Thinking about it.
Oh, no,
like
I
that.
made copies. I made copies from the thing that.
It's nice and simple, and
Yeah.
so you don't have to get to them.
Yeah, and, yeah.
Yeah,
The new stuff that we, it's like a copy. Copy here, and you already have one in the window. So,
That's been done in CPR, that they were training people on doing respiratory mouth to mouth, and after people.
Get back into the- that's what I started training, that they were saying, so they were like.
I don't know. Depends on what you want.
That's very.
Yeah.
Because it will circulate, but it was. It's part of the genetic code.
That's why.
Yeah, that's why it's important one time.
they couldn't be summer, and put them in the ice box, and then I go.
Oh.
Oh, it's right.
You just been.
Because I started bringing up my.
Sorry, the go-between, so-
They reached out and.
All right. There are a lot more people are reaching out. You know what it is?
She did not.
I just put it in. I just put it in.
Anybody, you know, I don't know
I
what,
put it
you know,
in
the
the, I put
EMS
it in the
team
micro.
ability will be, you know, I mean, in terms of the mass amount, but if you know of any groups that want to use, reach out.
Very good.
Yeah,
So,
so-
anyone else think it-
Thank you.
I don't know about it.
Anybody want to comment?
I don't go anywhere.
Assembly member of West